Welcome to WMITV News, brought to you by Horn Auto Center on the west deuce of Clubs and Sholo, the Chevy store that saves you more. Now from the WMITV newsroom, here's Laura Singleton.
Thank you, Mayor. So one of the things that that occurred last night, of course, in the council meeting is the proclamation. And so one of the questions folks have, there's a lot of words like emergency and declaration and proclamation. What does that mean for residents? Can you talk a little bit about how you govern under this sort of proclamation?
What it does, it brings and just unifies everything, where the president has his proclamation that closes how broad he has to get approval. The governor, it broadens, it lessens how far he has to reach out to make a decision. And so as a mayor, it doesn't take an entire council to make a decision. And so we're able to make certain decisions like impose a curfew, order the closing of a particular business or any business, close public buildings. So that's something that gives us the authority, as a mayor, to be able to make some of those decisions. I wouldn't do any of those decisions without consulting, but it puts those measures into place where we can move quickly in the event that we need to.
Sure. Okay, thank you for that. And so the funding is key, as well as consulting with the council. And so there's already been some buildings and facilities that have been closed, like the gym and the senior center and the aquatic center. And so can you talk about businesses? Is there anything that the city's recommending close or change how they're doing business?
We haven't recommended any change to the way that businesses are operating. You'll see that some of the franchise companies have authorized and made suggestive changes that they are doing. They're perhaps on some of the restaurants closing some of their dining areas. Other restaurants are maybe implementing more space between people there, and many of the businesses, restaurants particularly, have looked at going to takeout and delivery food. So as part of remaining and trying to keep within groups smaller than 10, it's important that we haven't required it of them, but what's one of the great things is a lot of people just self-impose and self-comply.
Sure.
And that's one of the things that we appreciate.
And they're adapting and offering services
everything
differently.
It is going to take an economic impact on the community. Every business is probably going to suffer in one way or another. There are measures that are being implemented right now as we talk. There's legislation that is trying to get laws passed and bills passed and relief passed. Right now, Arizona, Governor Ducey has applied for from the SBA to be approved as a state. There's some states that are already approved to for businesses to receive loans. Some of those states are Utah, Nevada, California. I don't have them exactly here on my list. I haven't been able to put all these notes together. I just got off the phone from them. But with that, Arizona has applied. And so as soon as we're able to get Arizona approved, that means that people can go to the SBA and request loans up as high as up to $2 million. And some of those applications will be processed in a 2 to 3 week period, and they'll have funds delivered shortly. That helps them stay in business. It's hard to have to borrow money to stay in business, but it is a way. They're also talking about paid leave administrations, different things where people can be able to have the unemployment kick in sooner. All of those things are being implemented. There's plans putting in place, but right now we do not have anything in concrete to say this is exactly how it's going to be. But all of those things are happening, and they're being talked about and working as fast as we can. One of the things that I do want to share with people that's very important is the school has shared here on the nutrition programs. They deliver nearly 1 million meals per week for children in certain rural areas. Their flexibility to allow meal availability for students. And Congress is considering additional bills to allow the USDA to feed more people during these times as well. And one point to understand is that our food supply has not changed. We have the very best in the world as far as food supply to people. So there isn't a shortage of food. It's just getting that food to the shelves again, because people have had a tendency to go out and to buy more than what they normally would. So you might see that there's lack of certain items, but as we return to just normal measures of our purchasing, you will see that catch up. And so it's just like, you can't drive a truck across the United States in an hour. It takes, weeks in some cases to get something that is in demand greater. So if we just allow that to process again, we will have our food supply strong again, because it hasn't been interrupted at all. Yes, you say some of those people may be laid off, or they have in those measures already for people, if they do get sick, that they have emergency workers so that the food supply works. So it's good.
Very good.
Any other question you may have?
The other question was with regard to public transit and the Four Seasons and the White Mountain Connection. Has that been affected? And if not, do we expect it to?
Right now, we have not closed our bus route. As people slow down their use of going from place to place, hopefully we don't get where the buses are as full as they used to be. So as long as we can keep order in the bus routes and not increase numbers, then you will see that we'll continue to keep our buses open. They're cleaning the buses more. They're trying to be more proactive on keeping them clean and healthy for people as well. If the people who are riding them will take extra precaution to clean and stuff before they get on, and only make those trips for an absolute necessity if you need to use the bus.
Very good. Good to know. Thank you.
Those states so far, I found my note, was Washington, California, Maine, Connecticut, Nevada, Utah, Rhode Island, and DC. And that's the emergency up to $2 million of an economic recovery loans.
And that was a very quick turnaround that you mentioned, with I think 2 to 4 weeks.
That is, for businesses, they can go to SBA, Small Business Association, sba.gov/disaster, and that's where they can start applying and do things as well. So that's
Excellent.
just one of the things that came out this morning from my call.
That's great information.
There.
Thank you.
As far as school buildings that we have closed the library. Library is still open. However, if you want to call online and place an order or place your books, we're able to fill that, and then there'll be curbside service that will bring it out to you. So as we get more and more testing going on, we will see an increase of the cases. It's just going to happen nationwide, but that doesn't mean that this outbreak is getting worse. It just means that we haven't tested people before, and we're getting more and more tests that we'll be able to start doing. But understand that if you test positive, then those people that are closest to you and around that you've made contact with will need to be quarantined. And so as we socialize, and if one of us became tested positive, we're jeopardizing more people to be quarantined. So the fewer and less contact we have with others, then the better it's going to be to slow this down and possibly be able to eliminate it the sooner than better as we can.
So just to interject one more thing, and this has to go back to meals. Mike Alsop, I think, gave an update, the Vice Mayor, in the council meeting about Meals on Wheels and the senior center meals. People can still get those. They can still call. Those things have not stopped. Can you
The senior center has been closed as far as for public gathering, but yet every meal that we have cooked or prepared there will still be delivered. And so also, if people want to sign up to get food from the Meals on Wheels, they can contact the city, and we can put them on the list for meals. So we'll continue to be implementing where meals can be, taken out for the best ways to keep them healthy, keep them aware of their needs, but not to come in personal contact.
Sure. If I could add to that, Mayor, one of the things that has also happened in the community is Summit Healthcare has changed some of their visitation policies and some of the protocols to kind of minimize that exposure to people who are already sick, who may already be in the hospital. And so that information's on their website and ours. And so sometimes folks that already have some underlying illness, it's really important that we protect them as well, because as you said, they're susceptible.
I don't, yeah, that's even, Summit has been very active in that. That's also a directive from Washington. As hard as it is that when you have a patient in the hospital, you want to be there for them. But in this case, we have to exercise the judgment that the people that are caring for them, we don't put them in harm's way by visiting. So it's almost, asked to please understand and please limit or stop your visits to people who may be in the hospital. It's very hard to do. They also are not going to be doing some of the tests and procedures on patients in the hospital just to keep open viable resources if they have to. So they'll only be doing what is absolutely necessary. But one of the things that we've learned from when we were little kids all the way up is hygiene. And if we will continue to exercise good hygiene, wash our hands until we've sang happy birthday 2 times and do all those things that we know that we should be doing, and have a handkerchief with you in case you have to sneeze or cough, those things that you have to do. Cover your mouth, and when you do, throw it away. But those are things that, it's interesting. Sometimes we think that we need to put a mask or anything on. You shouldn't wear a mask unless you are sick, unless you have been ID, because otherwise that mask traps in, because most of the places where you're going to transmit this is through your nose and through your eyes. So the least that you come close in contact with somebody and the further you keep that distancing, we can still have interaction with people. We just have to be careful of how we do it.